You might say there's a little bit of mask confusion going on in Chicago today. This after state and local officials issued mixed messaging on whether or not public transit riders have to continue wearing masks despite a recent federal court ruling. The bottom line after all those messages yesterday is no. Public transit users in Chicago and Illinois are free to wear or not wear a mask as they desire, even though COVID cases have started to rise again. And joining us now is Dr. Susan Bleasdale, Medical Director of Infection Prevention and Control at University of Illinois Health. Dr. Bleasdale, thank you again for joining us. Governor Pritzker made this announcement today, lifting the mandate on public transit agencies throughout Illinois after that federal court ruling doing the same. Your reaction?
Well, I think it's really confusing for the public, and I think it's important to recognize this change in the ruling for us here in Illinois is really a legal matter around what the federal case had decided on what the federal government or the state government can require. And it doesn't mean that COVID is gone or that you don't have to worry. It's really, unfortunately, now putting a lot of the ownership and responsibility on all of us as individuals to make decisions about masking and some personal accountability over what we're doing if we have symptoms of COVID and making sure that we're not working or taking public transit when we have any symptoms of any infectious disease for that matter.
And what is your guidance to folks who might be immunocompromised or vulnerable, who do rely on public transit or who had some travel plans and flights planned and now are very worried about that?
You know, I think that it is still recommended that you wear masks when you are in settings where it is uncertain, and especially to assess your own risk. So masks work very well in preventing the transmission of COVID-19. So for those that are compromised, that have medical conditions that put them at risk, you want to assess your risk and you want to make sure that you're wearing a mask when you're taking public transit, making sure that you're wearing a well-fitting mask, that you're staying away from anyone that might have symptoms of cough, making sure that you're keeping your distance. You might, even if you're not immune compromised, be thinking about this if you're not vaccinated, you're at higher risk, or even with vaccination, there's a chance that you could contract it, although it would be a much milder case. So you might be thinking, if I have a big trip planned, I don't want to have any exposures to COVID, so I'm going to wear a mask. If I'm going to gather with others that are vulnerable, I'm going to make sure that I'm wearing a mask in other areas like taking public transit before I'm going to go gather with my family that's very vulnerable. So those are decisions that you're going to have to make. And it is still recommended that you utilize masks to protect yourself and to protect others.
And public transit, airports, airplanes were kind of the last frontiers where masks were still required as mask mandates have fallen away most other places. Have these locations been seen as super spreader areas?
Well, I would say yes. As we have had the requirements for masking to loosen, we're seeing transmission. We've seen, schools in Illinois where some areas that there has been transmission in some schools because masking isn't required anymore. And as we are gathering in events, we're seeing transmission. I think the timing of this is very difficult this week because we're in the middle of, after a recent holiday that many people have celebrated. There's been several holidays over the weekend, people have gathered. And on top of this, we're seeing some increases already leading into this holiday weekend. So we're going to see more cases this week and into the next week. And so this is, again, very kind of bad timing in that it's confusing for the public that, okay, we don't need masks. So does that mean that it's over and we don't have to worry? And that's not the case. We are in the middle of some increases. And with this lack of requirement for masking, people may misinterpret that as there isn't a risk, but a risk of being around others on masks in the middle of increases it's just a risk of you acquiring COVID, and depending on your vulnerability could lead to hospitalization.
And many might wonder whether the decision to lift the mask mandate and not impose restrictions has political overtones or not. But in terms of the scientific data, is it fair to assume that hospitalizations aren't rising right now the way they did with previous rises in COVID cases?
Not yet, but I would say we are still at an early point. So the positivity in Chicago doubled from last week. We're at 5.8 for the positivity cases this week, and it was at 2.3 last week and 1.7 the week before. We're not at the critical point that we were leading into the end of the year. The hospitalizations typically lag the positivity increases by anywhere from 2 to 4 weeks, because we see these increases and it takes a little while into the illness before people need to be hospitalized, and then deaths lag that further. So in December, when we were in the beginning of this recent Omicron, or the most recent Omicron surge, we had those increases, but the hospitalizations really peaked that first week in January. So I think, we would anticipate, if we're going to see the change in hospitalizations, it's likely to be somewhere around the first week of May. And so, no, we're not seeing that yet, but I think it's early. We have information from the UK where they've been through their recent Omicron variant surge, and it didn't go to the same level that the prior one did from a positivity rate, but reportedly there had been similar rates of hospitalization that were seen in the previous Omicron surge. So we need to be ready that this may impact hospitalizations, but not yet. It's too early.
Public health officials, like yourself, are going to be watching that very closely then over the next few weeks. What about the supposed onset of warmer weather, whenever that happens? Will that perhaps dampen some of this rise a little bit?
Hopefully, because people can gather outside. That's a much lower risk. The other thing that may dampen the potential hospitalizations is treatments. It's really important that if people do have symptoms, that they get tested, that they get reliably tested, and they talk to a provider, because vaccination is, primary prevention. But even if you acquire it, we have oral antiviral medicines and injections with monoclonal antibodies that also can help prevent hospitalizations and deaths. So hopefully, now that we have an ample supply of those and the warmer weather, that maybe we won't see the same impact on our hospitalizations again. Hopefully.
And maybe there's a higher level of immunity now, both with vaccination or perhaps with folks that had Omicron. All right, Dr. Susan Bleasdale, thank you as always for joining us.
Thanks for having me.